Hey girl gang, it's Dr. Joy here and you are watching Delivering Joy MD TV. It's Super Mama Sunday and today I'm bringing you the double trouble. We're talking about twins and multiples today. So make sure you stay tuned for more details. All right, super mamas. So let's jump into our topic today. We're talking about twins and multiples. So twins and multiples can certainly occur naturally. They can also occur with assisted reproductive technology like in vitro fertilization. So when we're thinking about twins, people are always trying to figure out, well, what kind of twins are they? So today I'm going to break this down for you and we're going to talk a little bit about each type. We're going to talk about some of the things that go into being pregnant with twins or multiple gestation, and we'll hopefully hit all the high points. So when we're thinking about twins, we are thinking about two ways that twins can occur. Either we have two different eggs that are fertilized by two different sperm, and you have essentially two different people who are sharing a uterus. So that usually results in the baby having its own placenta, the baby having its own bag of water, and that there's simply just two separate pregnancies inside one uterus. So that would be your fraternal twins or unidentical twins. Additionally, you can have one sperm fertilizing one egg, and that egg actually divides after it's been fertilized. That's how you get your identical twins. So when we're thinking about this in terms of multiple pregnancies, if one egg and one sperm has actually been fertilized and divided, it can divide several times. And that's how you get your triplets, quadruplets, or either John and Kate plus 8. So the easiest way that I find to break down the types of twins is with an apartment analogy. So here we go. So let's say you have an apartment building. You can have two different apartments with two people living side by side who have their own heating and air conditioning control and who have their own refrigerator or kitchen. So that's the analogy for what's called dichorionic, meaning two placentas, diamniotic twins, and that means two bags of water. So dichorionic means two placentas, diamniotic means two bags of water. So in this analogy, you have two people who live next door to each other. They have their own place, their own stuff going on inside their apartment. In the case of monochorionic or one placenta twins, you can have two different types. So you can have monochorionic, one placenta, diamniotic, which means two bags of water. So this is the scenario where you have two people who are sharing a 2-bedroom apartment. Get it? So you have two people who are sharing heating and air conditioning, but they live side by side in separate rooms, okay? Because there's a wall dividing them. So those bags of water kind of act like the walls of bedrooms. You can also have monochorionic, monoamniotic twins. And that is the type of twin where they are both in the same bag of water. They're both sharing a placenta and both inside of the mom's uterus. So it would be kind of like, two people sharing a 1-bedroom apartment. So when I'm thinking about multiple gestations, they're super cool. People are so excited about them. But honestly, when I'm thinking about a person who has twins or multiples, I'm always thinking about what risks can occur. So in women who have dichorionic, diamniotic twins, so these are two people who are living in separate apartments next door to each other, this is the lowest risk type of twin.
Now, we talked about that two separate eggs fertilized by two separate sperm can become essentially two separate people. This can also occur when you have one sperm and one egg that split very early on. And so these would still be considered identical twins, but they are dichorionic and diamniotic with two placentas and two bags of water.
So I love it when I have moms who have dichorionic, diamniotic twins because their risk is much lower for mom and for baby actually. And this is because they have separate placentas and each baby kind of has their own stuff going on inside their own little bubble. When it comes to monochorionic or one placenta twins, that's when we really run into risk. And so some of the biggest risk is twin-to-twin transfusion syndrome, which can certainly happen in moms who have 2 bags of water but only 1 placenta. And this is a phenomenon where one twin is really getting all the good oxygen, all the good nutrients, and then the other twin is not getting as much. And so following the growth in any twin pregnancy is always very important, that we know how both babies are growing or how all babies are growing. And so usually the twin who has been overfed, so to speak, is the one that's at higher risk in twin-to-twin transfusion syndrome. Twin-to-twin transfusion syndrome is something definitely to learn about if you are carrying twins or multiples and any of your babies are sharing the same placenta. With monochorionic or 1 placenta, monoamniotic, 1 bag of water, these are 2 people who are living in the same bedroom and sharing space and relying on that 1 placenta for 2 babies. With this particular type of pregnancy, very rarely you may see twin-to-twin transfusion occur, but cord entanglement can be a real issue in this particular type of pregnancy. When babies are sharing a placenta, there can certainly be some issues with growth, with twin-to-twin transfusion syndrome, with cord entanglement if they're sharing a sack of water as well. So there is a little bit different thought pattern in terms of the timing of delivery. So when babies are sharing a placenta, we generally are going to recommend that those babies are delivered earlier. And the great thing about that is that twins and multiples tend to mature faster than single babies. So we try to really walk a balance between risk and benefit for both mom and babies. In women who have 2 placentas and 2 bags of water, or dichorionic, diamniotic twins, we're going to recommend delivery usually around 38 weeks. Of course, the conversation that you want to have with your healthcare provider is about the type of twins that you have and the recommendations for that type of twin or multiple gestation. Some of the things to keep in mind if you're pregnant with twins or multiples is that you're definitely probably going to see a little bit more weight gain. And if you didn't catch the video that we did about weight gain in pregnancy, I'll link it here in the cards and you can click on that and watch. But for twin or multiple gestations, the recommended amount of weight gain is usually going to be 37 to 54 pounds throughout the entire pregnancy. So you get a little bit more grace with weight gain since you're carrying multiples. And then in addition, there is certainly a little bit more involved prenatal care that's going on. So you may be seeing your regular OB as well as a high risk pregnancy specialist or maternal fetal medicine specialist who will be following your twins or multiples and making sure that they're growing appropriately, making sure that there looks to be adequate blood flow from the placenta to each twin. And so that is something that we watch a lot more carefully. So get ready for multiple doctor's appointments and have your skates on because you may be going to several different locations throughout your pregnancy. We also want to keep in mind that twins and multiples can be at risk for preterm delivery and preterm labor specifically. So because the uterus is being stretched much larger than it would be for a single baby, there can be a trigger for preterm labor. So the uterus may be stretched all the way out to a term single pregnancy size, and babies may only be 33 or 34 weeks. And so you can see twin pregnancies go into labor sooner. And again, twins or multiples tend to mature faster in terms of their lung maturity than single babies. And so with preterm delivery, they usually fare better. Of course, with double the babies and sometimes 2 placentas, you may also have higher risk for gestational diabetes or diabetes in pregnancy. And that is really because the placenta produces hormones that make you insulin resistant during pregnancy. So that means that your insulin that your pancreas is making is not really affecting the cells the way it should be. That can make it harder for you to use the sugar that's floating around in your blood. In addition, with 2 pregnancies or multiple pregnancies, hypertension disease in pregnancy can certainly be more likely as well. So keeping an eye on the blood pressure, and I often will recommend that my mamas will start a baby aspirin daily to help prevent preeclampsia. And finally, there's an increased risk of cesarean delivery with multiples and twins. And so that really is because you have to have everybody in position to come out safely vaginally. And if that's not the case, many folks will err on the side of caution and perform C-section. For me personally, I like to do what's called a double setup. As long as the twin that is closest to the exit is head down, then we often will set everything up for an emergency cesarean delivery if necessary. But go ahead and allow that mom to have a trial of labor and to try to push out baby A. And baby A is the one that's closest to the exit. And if baby A comes out vaginally, it's often pretty easy to get the second baby or the other babies out vaginally. Now, if an emergency occurs and there's inability to have the mom deliver vaginally for the second or third baby, then we would go ahead and perform a C-section. After about 2 babies, for 3, 4, and 5s, I usually like to do a C-section because that can get pretty tricky. But with 2 babies, my moms are usually able to have vaginal deliveries. They, birth just fine. So I think definitely something to keep in mind. For some women, this, is a little scary. I have some patients who actually request C-section because they just don't want to have a vaginal delivery and possibly have a C-section. So it's just something to think about, something to keep in mind. And if you have questions or comments, you can certainly post them in the comment section below. I hope today's video was a little bit enlightening to kind of give you guys an idea about how twinning works. If you enjoyed this video, give it a thumbs up and make sure you subscribe so that you don't miss a single episode of Delivering Joy MD TV. We'll see you next week, Super Mamas. Peace.